Hello, everyone. Welcome to the Pathways to Family Wellness podcast. My name is Dr. Brendan Reardon, pediatric and family chiropractor. And joining me today, we've got Dr. Satya Sardonicus. Dr. Satya, thank you so much for coming in.
Yeah, so happy to be here.
It's great to have you here. We've got a really fascinating topic. We're going to be talking about a lot of different things, the neurofascial connection, some of your work, which is going to be super fascinating. But first, let me read your bio to kind of give our listeners an intro into what we're going to be covering, and we'll jump right in. Today we've got Dr. Satya Sardonicus joining us today, a visionary healer, fascia expert, and creator of the NeuroFascial Flow Method. After navigating years of mysterious, debilitating symptoms that mainstream medicine couldn't explain, she not only reclaimed her own health, she pioneered a whole new approach to healing that blends fascial science, nervous system regulation, trauma resolution, and deep somatic wisdom. Dr. Satya now helps both individuals and healthcare providers reimagine what's possible, especially for those with complex or chronic conditions. Her work invites us to stop chasing symptoms and instead listen to the body's innate intelligence to create lasting change from the inside out. Satya, appreciate having you here.
So glad to be here.
Yeah, you can give us the long version, the short version if you like, however you'd like, but I'd love to hear about your own introduction into this work, perhaps some of your own healing journey. We're going to be following for our listeners some of the article that's in the spring, the current edition right now as a spring 2025 Pathways to Family Wellness magazine. So there's a beautiful article in there called Into the Chrysalis, but we're gonna be covering a lot of the material from that. So yeah, if you like, you can share with us how your discovery into this work and how this came to be.
Yeah, absolutely. So I am the seventh chiropractor in a family full of holistic healthcare providers.
Wow.
So I grew up very immersed in this world where, a lot of people who have come to a place of a more holistic lifestyle learned it as a teenager or an adult because of a health crisis or something that happened. But for me, it's all I've ever known that the body can heal itself, that I went from a fertilized egg to trillions of cells that all know how to do their job without anyone telling them what to do, least of all a doctor.
Mm.
And if I don't feel well, my parents raised me to look at what's in the way, which in a chiropractic perspective could be a brain body signaling issue, or why is your brain not doing its normal self-healing, self-regulating thing? It might be in an adaptive state.
Mm.
And so that background of philosophy that is just like embedded in my core being really uh, influenced me when I started having some really intense health issues myself. As a teenager is when we knew that issues started. I started having headaches and dizziness and nausea and symptoms got weirder, electric shocks in my arms and legs and muscle weakness. And it progressed pretty severely in my early 20s to the point where doctors didn't know what was wrong, thought maybe I had multiple sclerosis. They definitely said I had fibromyalgia, chronic fatigue, POTS. Now they might have said functional neurological disorder is another term I've heard thrown around that matches my, it's one of those terms that just describes symptoms with a label.
Yeah, we don't necessarily know what's going on, so we're just gonna
Right,
give it this
but
word, and that's a thing. Yeah.
yeah,
Yeah.
and I was, my dad is this incredible, incredible healer, like a wizard that people come from all over to see, and he couldn't figure it out. It's gonna make me very emotional. It was
Mm.
really hard. I mean, I consulted with some of the top chiropractors, with Carrick, with Murphy, with D'Onofrio. None of them even considered as a differential what I actually had,
Yeah.
which is because of um, technology evolving and upright MRI versus laying down MRI.
Isn't
And
that
when I was
interesting? Yeah.
in chiropractic school, I was at that point used as an example in all my class, like my neurological classes of
Yeah.
pathological reflexes. I had all of them. I would
So
just
as
collect
an adult, right? We're talking as an
as an
adult.
adult in my
Yeah.
early 20s.
Yeah.
I had every pathological reflex, these
Yeah.
reflexes that, definitely shouldn't exist and are saying your brain is there's something very wrong
Yeah.
happening functionally. And I had like my whole left side was weak and my right side was twitchy and spastic. I mean, it's crazy. I had a laundry list. I think I had 17 chief complaint symptoms.
Wow.
Like it was
Wow.
nuts. And I Ended up only because of an upright MRI at my chiropractic college. They just happened to have upright versus laying down. They were looking for plaques in my brain from MS. And
Hmm.
they said, oh, actually, your brain is sticking out the base of your skull. And so what most doctors had come to over the years was it's all in your head, like when they
Yeah.
couldn't figure it out. And I was like, turns out it's not in my head, that's the problem.
Yeah,
Like
it's kind of out of your head. Yeah, yeah.
literally my brain's falling out. But it
Yeah.
was actually from a car accident when I was 7 years old.
Wow.
And interestingly, when we looked back, we thought I didn't have symptoms till a teenager when I had like a 10-mile-an-hour fender bender is actually what triggered the start of those symptoms. But my dad and I were talking kind of recently, and he's like, actually, you did have symptoms after the car accident when you were young.
Yeah.
Like we knew I had three herniated discs in my neck and one in my low back. It was a really bad accident.
Yeah.
But we didn't know that we think now my brain actually got herniated that day and it was
It's,
missed for 20 years. And the symptoms I had as a young kid that we didn't realize were symptoms was that I was more sensitive, I was more emotionally reactive. Like I would get upset more easily with my siblings. I wanted to control my environment all the
yeah.
time. And like my parents just thought it was like my personality, basically.
Yeah.
And it's interesting because so much of the time I've seen that happen where this condition, like it sounds crazy, my brain's sticking out, but 1 in 20 people with neck pain who've never had a head injury have some degree of brain herniation.
Isn't that interesting?
And you can only see it on an upright MRI, like not only, but when you lay down, gravity changes the position of the brain. And so it's easy
Yeah.
to miss when you're laying down. But also, if you've ever had any whiplash, concussion, like even you bonked your head and you were sent back out to play, as happened to
Yeah.
us in the 80s and 90s a lot, right? 1 in 4 people
Wow.
have some degree of this condition and don't know it. And it gets misdiagnosed as fibromyalgia, sensory processing problems,
Yep.
ADHD. Like there's a lot of chronic fatigue, POTS, a lot of these diagnoses that are getting thrown around when people can't figure out what's going on can be tied back to this. And that's certainly not everybody.
Yeah.
But it's a really wide range of people. But how I ended up in this world is that I wanted to avoid the kinds of invasive surgery that they wanted to
Sure.
do about it. But I realized I also had a lot of symptoms that were shared with my patients. I used to, early in practice, I specialized in working with children with autism, dyslexia, schizophrenia, Tourette's, like um,
Hmm.
nervous system, brain stuff. And I was like, wow, me and these kids and their stressed out parents taking care of
Yeah.
high needs kids, which probably all kids are high needs, but right, like we all shared these symptoms. And I was like, oh, we
Yep.
all have nervous system dysregulation, but the fascia came from me trying to solve the brain stuff that I had. And I just
Yeah.
realized it was relevant to everybody, even if they don't have this condition.
And what's interesting too, it's not like there was a lack of hands-on attention. There were a lot of people looking at it, but it
A
was it was
lot, a
such
lot
a
of very skilled people. Yeah.
yeah, yeah, like very skilled. Um, it's interesting. So something about that mechanism created like a certain torquing or a torsion in the nervous system that essentially like pulled the brain down out through
Yeah, so
magnets.
when you have whiplash,
Yeah.
it puts this tension on the spinal cord and
Yeah.
can pull your brain down, traction it.
Yeah.
But we can also have too much tension in the spinal cord, even if the brain isn't getting pulled out. Oftentimes, people have tension in the spinal cord going from the brain all the way down through the connections of
Yes.
the
Yeah.
fascia, the soft tissue, all the way into the soles of the feet. And so that connection, between the dura mater, the lining of the skull and the spinal column, through the tailbone, through the fascial web in the back of the legs and into the plantar fascia,
Yeah.
that dural fascial kinetic chain, I actually coined that term because I couldn't touch my own head and neck, let alone let someone else do it. It was too reactive. And I was like, how can I reduce tension in the spinal cord? And I thought about like stockings falling down, like
Yeah.
pantyhose. And I can't pull them up from the waistband. You have to start down by the toes and feed the length up. And so I experimented with actually pulling like feeding length up that fascial chain from
Mm.
the legs. And it actually alleviated tension in my head and neck so dramatically that like had way fewer headaches. And I
Yeah,
actually published a study in, I think it was 2015, in for the Canadian Pain Society. I presented research and then it was published showing a reduction in my patients in headache frequency and intensity by doing this work in the DFKC.
that's
So
amazing.
that came a lot. It like came because I had a brain herniation, but so many people have tension. Like dural
Yeah.
tension is a thing that chiropractors and craniopsychotherapists and some PTs pay attention to,
Yeah.
but backing it up to the fascia in the legs, it's super connected.
Yeah, and even if the brain's not coming out through the foramen magnum, there's still going to be a level of, for a lot of people, of like twisting and torquing that's happening, and it's going to
Totally.
cause. It sounds like what you're saying. There's going to cause an irritation of the nervous system, right? So,
Yeah.
so then, people t mentioned, oh, maybe this is just your personality, Satya. But it makes you wonder how many different like quirky personality traits are just extra stress and tension on the nervous system. Um,
Yeah, it really
so
distorts the sensory processing. It
yeah,
like one, it physically can irritate the brain and spinal cord because of the close relationship mechanically between the sleeve around the spinal
yeah,
cord, protective sleeve, and the brain and spinal cord itself. But also when there's too much tension in the system, it drives alarm signals to the brain 24 hours a day, keeping it
mm,
in an alarm state where it goes, I
yes,
need to be hyper reactive. I
yes.
need to have more aggression, more anxiety, more depression because my life might be in danger. I need to
Yeah.
disregard and deprioritize growth, development, reflex integration, digestion, like
Yeah.
fighting infections and cancer. And instead, I need to be hypersensitive and hyperreactive to like allergic type responses. And these are all super normal things, but how many what chronic challenges,
Yeah.
health challenges did we just name?
And what I've read about this, maybe you'll attest to it as well, is that our nervous systems are beautifully adapted to handle stress, but it's typically beautifully adapted to handle stress shorter term.
Mm,
Like we have to immediately run from the lion or protect
right.
our
It's
family.
meant for
And
what
it's meant for
babies
like
baby weeks.
short term. It's like the turbo button, right? You press it and and then you're like ramped up. But when that's stuck on for a long time, you're all jacked up on Mountain Dew for too long, it becomes a very it can become very, very destructive to the our sense of peace and well-being, and overall quality.
Yeah, that's an interesting it's an interesting term you use, destructive,
Yeah.
because I I I am always just really interested by language because I think
Yeah,
that we have words that are like going to be influenced. The meaning I assign to a word is influenced by my whole experience,
sure.
and the meaning you're assigning is by your whole experience. So I bet we're saying the same thing, but it's so interesting because I think there's a common
Yeah,
like thought process around these symptoms that I don't believe you meant or hold, but that a lot of people think it's your body being broken or doing something wrong.
right, right.
And it's not necessarily it's not at all. I don't think it's doing anything wrong. I think it's doing something very intelligent and adaptive.
Yeah, yeah.
Um, which,
It's a
is very congruent with the philosophy we share as
yeah.
chiropractors.
Talk to me about that a little bit more, the intelligent adaptations.
Yeah,
Right, if there's this incredible wisdom, which there is, we know there is, why have that show up in that particular form? Right.
absolutely. So, for example, um, the body will deprioritize fertility,
Yeah,
reproductive function, because your brain says, well, it's not safe to bring a baby into an unsafe world.
yes.
You'll deprioritize fighting infections and cancer because those are long-term threats, and I have a short-term threat in front of me.
Yeah,
And we
interesting.
need to mobilize our resources. I need to, actually, the brain, when you're in a state of alarm, the brain neurologically suppresses your ability to have compassion and to see another person's point of view. Because if you were busy being compassionate for the tiger, you wouldn't fight for your life.
That's fascinating. So there's a
And
tremendous
so
wisdom in that. Yeah.
it's so intelligent. It's
Yeah.
like you said, you hit the nail on the head where we're just not meant to stay in that state of alarm for a long period of time.
Yeah.
But when we do, it's because your brain is still perceiving threat. And so the question becomes not how do I fix my gut symptoms or
Yeah.
how do I fix my kids' hyperreactivity or
Right.
learning difficulties or persistent reflexes, but or even as a chiropractor, I shifted from how do I fix all of the subluxations and all the stuck places to how do I get the system to actually prioritize healing and development again?
Yeah.
How do I get it to come out of, because I'm of course like I'm going to use crutches when I have a sprained ankle. I'm going to feed someone fish while they're learning to fish. I'm going to adjust my patients and clear their system while I'm trying to teach their system to hold its own clarity.
Yeah.
But that the second part of that is what's so crucially important, that there are so many beautiful ways that we have of trying to help the body with healing.
Yeah.
But I really find it the most congruent for me if I say the body is self-healing and self-regulating, then my number one priority as a provider is going to be, how do I make sure I can get your system to optimize its self-healing, self-regulating function? And how do I do that for myself when I've faced chronic illness? Because not only have I healed, coming through massive and multiple brain injuries, because I've had so many concussions, like actually re-injuring that thing. But I also used to have chronic Lyme in my nervous
Mm.
system, and I don't. And I also had multiple tumors grow really fast 6 years ago, and was
Wow.
anticipated to survive maybe 2 months in that situation.
Wow. And here
And
you are.
I
Yeah.
literally did the same thing every time. It's gonna make me
Yeah.
cry because it's like, of course it's terrifying. Like but I've lived through this, and I know that every time I've faced crazy health crises, which seems to be my like my path in this life is to go through it and solve it in this way and literally show
Yeah.
others that it can be done. I did not treat the symptoms of any of those things. I didn't do like everybody, by the way, everybody's
Yeah.
cancer process is different. For me, I said I'm not going to treat the tumors. They're just a symptom that my nervous system and my immune system aren't functioning in their normal adaptive way.
Yep.
And I had to look at, why is my body not healing itself? And there's all sorts of structural, chemical, emotional, spirit, like reasons for that.
Yeah.
And it's a different focus. So it's not necessarily that I used different tool, like I was still getting adjusted and doing acupuncture and
Of
meditating, doing
course.
the things, but it's the shifting of the focus to, I can, as an acupuncturist, I could stick a needle in somebody. I'm not an acupuncturist, I'm just saying. Like acupuncturists could stick a needle in a muscle for the purpose of trying to make the muscle relax, or they could stick a
Yeah.
needle there because they're trying to open up the channels so that the energetic pathways can communicate, so that
Yeah.
the body can heal itself. And the same with chiropractic. Like I could loosen up a stuck joint because it's messing with this nerve signaling right here. Or I could loosen up this stuck joint with an adjustment because it's going to help the whole system have better brain body signaling, but also get out of chronic alarm mode, because when you loosen up something stuck, you help reduce the alarm signals coming from the stuck places as well.
Yeah.
So it's just this like frame of, what's the
Yeah.
purpose? What's the
Yeah.
purpose
No,
of
it's
what I'm
beautiful.
doing?
And I
Yeah.
think that's the promise of this work, is guiding the body towards becoming more self-aware and self-healing. I think
Yeah.
as practitioners and in the general public, it's really easy to get focused on end organ issues. Like what's the end chain of the result of all of this, these levels of compensations and adaptations, and we see an end organ issue, and we get really focused on the end organ issue. And we
And
have,
it's and like look, it's terrifying having it. Like when I had Lyme, I would, if for a few months, if I ate anything other than blended watermelon or cucumber through a straw, like anything else, my face would swell up and
wow,
serous fluid would leak out of everything from my eyes down to my chin, all across my cheeks and my lips overnight, and my mouth would crust shut overnight.
wow,
Like I had so many food sensitivity. I mean,
yeah,
I've had really major health problems that I've come through because I stayed rooted in my body knows how to heal.
yeah,
I have an immune. Why is my immune system not fighting this? What do I need to do to support that process? Not how do I micromanage it with a million supplements, which supplements can be helpful. Like again, crutches when you have a sprained ankle,
yeah,
like
yeah,
that could be supplement crutch, like that can be useful. And I have absolutely found that useful. But looking at like the underneath, why is the system not healing itself? And how do
yeah,
we get it to want to actually hold. And the neurofascial interface is such a beautiful place for that because of course, I listed all these different influencing factors, but the one place that I've seen missed in the majority of people who are trying to help
Yeah.
get out of alarm mode, like deal with stressors. I don't just mean emotional stress, but all the kinds of stress. Um, the one piece that I've seen missing the most is that actually when anywhere in the body isn't moving fluidly.
Yes.
Like, I don't mean you can touch your toes. I mean articulate through all, like, think of the slow motion video of like a cheetah
Hmm.
running. And you can see every single, they're so supple, like every centimeter
Yeah.
of their body can articulate in concert. And when we lose the fluid adaptability in the body because we've had some kind of intense experiences where the body couldn't figure out how to process it, it gets stuck, trapped. And we splint and we brace and we freeze, and that's normal. But if we don't get back to fluid, then it's actually perpetuating alarm signals 24 hours to the brain, keeping
Yep.
you in an alarm state. Even if you ate perfectly and you sleep well and you love your life and you feel connected and supported in your community and connected to some sense of spirit for whatever that means for you, but you have stuck places in the body 24 hours a day, they're sending alarm signals. And chiropractic loosens the spine ones, which is so awesome and crucial, but there's the fascia that also
Yeah.
holds it as well.
Yep.
And we've got to look at that and we've got to help release those stored places in a way that doesn't feel violent, because that can happen a lot of the time because it was tight as a protective function.
Yep.
And then you just try to like get a massage or do some gua sha or foam rolling or scraping or cup, or like all these really intense things, and the body actually often perceives that as an attack and
Yeah.
gets more dysregulated.
What's loading the system more? And if we're really going to say that the body's intelligent, then we have to understand that all those adaptive and compensatory mechanisms are there for a reason. So we have to like tread very, that's how I take this as a practitioner, to try to tread very lightly when you're working with those patterns and understand, the consequences of where an input in one area is going to affect the other parts of the system as well, or the potential implications of that. Um,
Yeah.
yeah. So are some of the things we've talked about, would these be communication pieces? Let's say you're talking to folks that are just have really lost confidence in their body, right? They're like, well, this sounds nice, but like that's not for me, like this is I don't know if this whole like body's going to heal itself business, I feel I'm sure you've worked with some folks that feel pretty far gone and like they've gone through a lot. How do you connect with them and communicate with them to help them feel more in their body? If that makes sense, that question.
It's such a sacred moment.
Yeah.
One to be held with a lot of grace. And I guess first I would say to that person, if you've lost confidence in your body, that makes so much sense, especially if you've been doing everything right and still
Hmm.
not seeing change. It's not a failure, it's a sign that your system has been working really hard to protect you, maybe for a very long time. And what I would want you to know is this, that healing isn't about going back to who you were before. It's about becoming someone new, someone who's reorganized, who's more adaptive, more at home in their own skin. And I've seen bodies that were completely shut down begin to soften.
Yeah.
Nervous systems that were locked in survival start to breathe again. And it wasn't through force, but through creating just enough safety in the system and spaciousness for that internal reorganization to begin. So you don't have to believe in healing yet. You just need a small moment of willingness to wonder if something else is possible.
Yeah.
And if that spark shows up, however faint, like I would love to help you nurture it.
What a
And that's
beautiful
really
thing.
what neurofascial flow is about creating a container in which your body wants to reorganize.
Yeah. And to your point earlier, I think it was said so beautifully where if there's tension on that nervous system, that's going to create a state of survival where it might even be hard to conceive of the possibility of anything getting better because of the level of how things are stuck in the nervous system. Like their entire state of being, your perception of reality is going to be based upon that state within the nervous system.
Absolutely. That's the lens through which you are viewing your whole experience, that the world is dangerous, that your body is an unsafe place to energetically inhabit
Yeah.
because you're in so much pain and dysfunction for so long. And I'm tearing up because one, I've felt that way myself many times. But also I'm thinking of this little girl I took care of. I think I actually put her story in the article, but she had been at 8 years old. I think she was 8 or 10, I don't know, young. She came to me after she was hospitalized for trying to hang herself. And I remember doing an exam and history, and then I was in the like report strategy session with her family, and I was talking to her because I always talk to the kids and do the report with them because usually doctors talk over them.
Hmm.
Um, and they, anyway, I said to her, I said, I think that your system is stuck in this alarm place where everything feels dangerous and like an emergency, and it's really hard to feel safe. And I can see that there are places in your body really holding that tension where it's really stuck and wound up. And I think that if we start to soften some of that and you start to do some of these, like I developed these exercises that help restore
Hmm.
safety to the brain, um, then we can help your system start to come out of that and be able to heal itself better. I said, do you want to try? Do you want my help? And she started crying. She said, I don't I don't know how to think that that's even possible because
Yeah.
we've already tried, like they've been to a lot of different doctors, they put her on different medications. And I said, "That's okay. Do you want to try?" And she said, "Yes." And I'll tell you, within 1 week, that was a different child.
Wow.
I mean, her her mom, her grandma, like they all got under care and just they watched her transform in front of them after she'd been suffering for so long. And it's not that other approaches are always wrong. It's that the nervous system isn't necessarily in a state to fully receive them.
Yeah. Yeah, that's just it. Maybe those things would have helped out after the fact. Who knows? It's a, but
Possibly, and that happens so much of the time when I have patients come to me who've seen other chiropractors or
yeah.
craniosacral therapy, even like PT, like things that, or brain retraining, OT. Like I had another little boy I
Yeah.
took care of, 10 years old, who'd been seeing an OT for, I don't know, a year and a half, something like that. And he'd done pretty well according to their standards, but he still had some stuff going on. And his mom brought him to see me. And 4 weeks into care, the head of that OT clinic called me and she said, "What OT are you doing with this kid? He just did an assessment and he's made more progress on their assessment, more progress in the past 4 weeks than he did in the last year."
Wow.
And I said, I literally have done zero brain retraining. I've done no brain exercises with him. All I've done is help get his system out of a state of chronic alarm. And it wasn't all done in 4 weeks, but it was enough different that suddenly his brain could
Yeah.
integrate all of the awesome brain retraining stuff that the OT had been doing with him.
Yep.
And he
Yep.
started understanding fractions in school and he started like eating new foods. Like,
Yeah. That's
it
amazing.
affects so many things.
That's incredible. Yeah. So what are some, you said there's some exercises folks can do on their own, some at-home things you'll teach, what are some of those? Those were in the article, but for folks that, are listening as well, what are some things folks will do that on their own?
Yeah, I'm totally happy to share a couple of things. I would love to because I always think that it's more important to understand the why behind things because then you can also
Yeah.
modify them. So I'd love to share a little bit of context and then I will totally share a couple things people can try if that's cool.
Yes, of course. Yeah.
Yeah. So, because like protocols are never going to be perfect for everyone.
Of
And
course.
so this is one of the things I've really held fast with in neurofascial flow is that I don't give people any protocols. I teach you more how to know how to read your body's signals and how to figure out what your body needs.
Yeah.
And so there's a little bit of background that I think is important here because knowing how to think about what's going on with your system or your child's system, I think is even more powerful than like one thing you could try.
Sure. Yep. Yep.
So we often think about fascia as just connective tissue, but it's also a major sensory organ, especially along what I had mentioned. I've called the dural fascial kinetic chain, or DFKC. Tension in that system can send the brain this constant alarm signal. And so even when the external environment is calm, the internal signal says we're not safe. And that's why some kids and adults stay in chronic stress even after trying therapy, diet changes, mindfulness, even chiropractic sometimes
Hmm.
can be limited, when this chronic alarm is there because the brain can't shift because the body's still bracing. And
Yes.
so even though it's often treated like this passive packaging, like this spider webby stuff that's just kind of there, it's actually a communication highway, that there are signals that travel electrically across the fascia and through these tension lines. So it's really important to address the fascial tension.
Yep.
Um, and like I said, the body doesn't hold tension because it's broken. It's because it's remembering some act of protection it needed.
Hmm.
And when it gets stuck for a long time, then it can feel really unsafe to just release it. And so I often think of like if a kid is reactive or anxious or avoids certain textures or sounds, it might not be behavioral, it might be the body operating in this defense mode.
Hmm.
So now I need to talk about the nervous system for a second, and then I'm going to talk about why they're together.
Yeah.
So if you
Great.
smash your finger, the first thing you want, it sends alarm signals to the brain. And the first thing you want to do is shake it or squeeze it, maybe after cursing, but
Yeah.
but right, the shaking and the squeezing both send these signals to the brain that signal safety. And that's the built-in system for overriding a threat signal with the signals that are called proprioception. So the same principle applies to fascia and nervous system healing, where the fascia has a massive density of proprioceptors. The spine has the most in the body, the
Yeah.
feet have the second most, and that's why chiropractic is so powerful, by the way, because not just because of the brain body signaling, but because any stuck joints in the whole spine are starving the brain of proprioception that it should get when you just move around in your life.
Yeah.
And so it's not just sending the alarm signals, which it is, but it also is starving the brain of proprioception. And so one of the places we can start is actually supplementing, like taking a vitamin. You can give the brain extra proprioception because you can't open up all the stuck places right away, but you can give the brain extra deep pressure to help it feel safe. And
Great.
so this is the first exercise that I love, this neurosomatic practice. I call it the safety squeeze or squeeze hugs, but you basically take broad hands, like the palm of your hands, not finger claws, broad palm of your hand, and make like a wave-like compression on your wrist, and then move an inch down on your hands because the receptors are in the joints and the soft tissue. So you hold each one for like, I don't know, 1 or 2 seconds, and then move to the next spot and move up and down the arm, and you can do them on both at the same time if you're coordinated. Um, but it's not a massage. I'm not trying to loosen tight muscles. It's the same science of a weighted blanket, actually,
Mm.
or
Yep.
like thunder jackets for anxious dogs.
Yep. Yep.
It's the deep pressure that you can see. I've been doing it since I started explaining it a moment ago, and my voice tone has dropped and slowed down. And I didn't do that on purpose. I was getting excited and buzzy, and that's how fast it actually can shift the nervous system.
Yeah. That's
Uh,
cool.
it's so cool. I'm remembering I had this woman call me once, a new patient, a mom, on a Friday night, and I was going to be heading out of town for the weekend. I was teaching a class, and so I couldn't see her baby till Monday. And I could hear the baby crying. She's kind of crying. Like I don't remember precisely, but the baby was like somewhere between 4 and 6 months old, and it had never slept more than like 45 minutes. It was crazy. And I described to her basically how to do these squeeze hugs on her baby. I said,
Hmm.
just, and it's not just on the hands and arms. I described that a second ago because it's easy to reach, but the feet is actually a really nice place to start.
Yeah.
Because again, it's the second highest density and it feels often safer than squeezing the torso or the neck, which yes, the
Mhm.
neck has a lot of proprioceptors, but that doesn't necessarily feel safe. It feels more vulnerable. Um, and
Especially if
so
someone's at threshold, when you were
yeah,
describing your own sensitivities where like
yeah,
it would flare this things were so loaded that
it
for
can
you getting
flare.
any contact on the head and the neck was too much
Absolutely.
stimulus
So
because it's
I
such a
love
rich
starting
area
at
of
that age.
proprioception. Yeah, exactly.
Yeah, yeah. And also teaching your kids to do this on themselves, or this is a really great
Yeah.
to get your partner to give you a foot massage.
Yep.
But
Yeah.
but not a massage because I'm not talking about trying to make something loosen. It's just
Yeah.
squeezes.
Yep.
It's just deep pressure squeezes.
Yep. Yep.
If someplace hurts, skip it. This is a global phenomenon. Like the
Yeah.
receptors are
Mhm.
everywhere. So anyway, I did that and she calls me. I gave her my cell phone. She called me the next morning crying. And I was like, what's going on? And she said, my baby slept for 5 hours last night.
Wow.
And then this morning, she latched on and nursed for the first time she's successfully latched in her life.
Wow.
And I just think about, like, of course, there was some deeper things for me to do, but also as a chiropractor, it was a lot easier for me to work on that baby now that mom had been able to get the ball rolling by establishing some safety and facilitating
Yeah.
softening in
Yep.
that child's system before I tried to go in and do any kind of adjustments.
Yeah. And I'm sure you see that with babies born into either like traumatic or semi-traumatic situations where, that nervous system is just really locked up and jacked. And if you try to jump in the deep end too soon, it's going to
Oh yeah,
backfire. So you have to
it's it's
start with,
it's wild. So much
yep,
of the time, the chiropractors that I train, it'll come up, oh, this baby came in, but like they were crying and I couldn't work on them, or this toddler was too upset.
yeah,
I'm like, and the mom's just like, just do the adjustment. And I always say, let's not do that because all change is hard, even in the right direction.
yeah,
And when you're in, like, I think I first learned this from Bruce Lipton, cell biology, but cells can be in defense mode or they can be in growth and healing, and they can't be
yeah,
in both at the same time. So if a system is locked in defense, then even if you successfully get the change to happen, even if you loosen the stuck thing or the tight muscle or the whatever it is, it's just gonna, like, best case scenario, it's just gonna revert back to the way that it felt safe.
yeah,
But worst case, sometimes we end up actually causing dysregulation in the nervous system,
yep,
and it will resist that change next time. And I think that's a lot of why we see people needing the same exact adjustments over and over and over. Beyond a few, there's some repetition to retrain old habits, but when you're
yeah.
seeing
This the
the same
system
thing,
habituates, right? It
yeah,
desensitizes and habituates. Yeah, and I'll on that
yeah,
same point, I'll communicate that with parents as well. Because like, just do the adjustment. It's okay that they're crying. I'm going to hold the baby down really hard, and you can do your thing.
right?
And I'm like, no, 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 no.
I'm
Like,
like,
and
absolutely
I have to
not.
say, like, I was really trained to adjust into ease. So first we need ease. And I try to explain, like, if I try to do this here, there's a chance it'll work, but the window is so tiny that if I'm not absolutely perfect in my application, like, there's a greater chance that it's going to backfire. And I was like, I want to
Yeah,
work with, like, for me, I need the system to be into ease. So we're going to work towards ease and then we'll be able to jump in the deep end a little bit more. But like first
totally.
we have to get it, first we have to get
Yeah,
to a relative level of ease.
yeah. And
Yeah.
so proprioception is a powerful way to be
Yeah.
able
Yeah.
to cultivate that and to help establish that ease. And of course there's other components like the environment, the sounds, the lights, the other things to
Yep.
signal safety. But proprioception is a really powerful way because it's the body's built-in mechanism to
Yeah.
recover from alarm. And so when we can bring that in, then it can help really get the softening ahead of time. And this actually leans in perfectly to the neurofascial framework is actually a 5-step process, and almost every technique or therapy I've ever found goes straight to step 3.
Okay.
But I think this is actually what most masterful,
Oh yeah.
facilitators of change are doing. I don't think I invented this. It like came through me, like
Yeah. Yeah. Yeah.
prism. But step 1 is establish safety. Step 2 is facilitate a softening from, like, invite the system to soften on its own. Step 3 is do the change, but only as far as the nervous system can integrate. And so there's a skill that I teach in my programs, and I can kind of describe it here, but it's called somatic tuning, where you can feel in yourself, and also I can, as a provider, you can learn to feel it in someone else, but there are palpable um like perceivable things that change in the system when you start to go into alarm. And if you can, like, your heart rate going up is one of them, right? So we can put like a pulse oximeter on somebody and watch their heart rate while we're working on them. But also there are sensations like of constriction or tightness or shortness of breath or kind of wanting to clench inward or an aggravation of symptoms that are already there. Um, versus when you go into ease, you see a sense of expansiveness,
Yeah.
openness, softening, and it's a little bit different from one person to the next. So, in my inside the Chrysalis in my membership, I actually teach people like how to figure out your own unique ones. But overall, it's a sense of constriction versus expansion.
Yeah.
And the earlier you can notice that in that step three, when you're doing whatever change, whatever therapy technique you're trying to do, even as I go to like set up an adjustment, I am noticing I'm doing that somatic tuning. Like, is this at least neutral? It should be somewhere between neutral and awesome, is what I always
Yeah.
tell my
Yeah.
people. Like, and I want to engage them. I want them to be able to tell me because if they are going, it's okay, it's almost done, or I can handle it, or just hold the
Yeah.
breath for a second, or wiggle your toes, or be distracted, like that's not it, because if the goal is just to loosen the stuck thing, that's actually fine. But if the goal is to help your nervous system come out of alarm and cultivate a self-healing mode, then it's not worth it. And the adjustment doesn't even matter at that point if it was at the expense of the nervous system going into alarm. And
Yeah.
so
Yes. No, go
I
ahead.
was I
Complete
was
your
just going to
thought.
finish
Yeah.
the
Yeah.
five steps because I stopped in the middle there.
Okay.
I've talked a lot about step three, but then step four is as soon as you hit that threshold, you reestablish safety, which again,
Okay.
proprioception is a powerful way to do it. And then you integrate and adapt to that level
Okay.
so the brain can make a new set point of self. And then you can go through that concentrically bigger and deeper. And it will really mean that the healing is up spiraled. Like I just get the ball rolling in a session and it should actually continue unwinding between so that we can go deeper next time instead of just, oh, I went back, now I have to do it again. And I went back,
Yeah.
I have to do it again.
So talk to me about the system going into chaos as it's reorganizing, which can be a part of the healing process as well.
Yes, I'm so glad you asked about that. So, when a caterpillar goes inside the chrysalis, its little protective cocoon, it doesn't just grow wings. It actually turns to liquid. It turns to goo. And from the outside, transformation often looks like destruction. And you think about even a seed sprouting, it's exploding. Like you
Yeah.
can't, it looks like this. And how many of us have had times in our lives where something crazy happened and you feel like everything is falling apart. And ultimately, that's what allows us to reorganize into the next iteration of ourselves. And I
Hmm.
often tell people that if you've had a closet and you shove stuff in it for 20 years, shove stuff in it for 20 years, and shut the door, and then you want to organize it, you got to open the door, you got to take everything out and make a huge mess on the floor while you're trying to reorganize.
Yeah.
And healing can really feel like that, where, you know, when we can't figure out how to process something in the moment, whether that was a physical, a physical thing, the body couldn't disperse the force because there were too many rigid places in the body, and so it got trapped as more tension, or an energetic or emotional experience that we couldn't handle, we trap it in the body, we freeze, we splint. This is what I
Yeah.
said earlier. But we have to come back to fluid again. And that means sometimes feeling the things that got trapped in the body. And actually, sometimes the only way through is through.
Yeah.
And to crack open that window, and I feel like probably it's very emotional for me. It's probably one of the most sacred things that I can do to help someone is to stand by them and hold a container of safety like a chrysalis
Yeah.
where they can fall apart, where they can actually go back to liquid, to take down the bracing that has splinted through the body over time and feel safe to reorganize.
Yes.
Uh, and nobody can do your work for you. All I can do is bring someone to a stand for themselves. And that really often means feeling crazy in the meantime. Like
Yeah.
I will often say as a human, I really want you to feel better. And as your doctor, what I really want is for you to feel better. I want you to feel more accurately. And
Yeah.
sometimes that means feeling more pain. Sometimes, I've had people say, "Oh, now when I eat dairy, I get a bellyache." And I'm like, "Well, I didn't give you a dairy sensitivity, but
Yeah.
now you're actually noticing when your body is trying to tell you something, and
Yeah.
you can feel it. And it doesn't necessarily mean feeling less pain, although sure, we become we we get a greater capacity to hold the broad experience of life. You can't selectively numb to just pain. You numb against joy and connection at the same time. And so I don't even think the point is to just have pain relief. The point is to be able to not get knocked off my center just because I'm having the messy range of experience of humanness.
Yeah. Well, and that as we're going through it, that would feel like a distinct lack of ease, even though it's the system reorganizing at a higher level.
It's very disorienting to feel like everything's
Yeah.
falling apart, and I think that that's something, especially as a recovering type A in person, because I've had so much trauma. Of course, I've wanted to control my environment my whole life,
Yeah.
right? Um, but it's that developing a sense of coherence in my own system and capacity to roll with whatever happens. And that's fluidity. That's not, it's not resistance. There's no resilience doesn't mean resistance to stress or never going into a stress response or never feeling pain. It means
Yeah.
actually being able to roll with it. It means
Yeah.
being able to stay to maintain my sense of fluidity in my body, which also mirrors into my brain. Um, Even when there are storms, because
Yeah.
we don't know what's coming our way in life. But what I do know, and why, that used to make me feel really anxious, being like, well, I could get in another car accident at any time. But what I realized is when you lean into, I am resourced. I've come through all of the experiences I've had in my life, and I was able to come through them, which means I am the constant. I don't need to know what
Yes.
external forces are coming because I am the constant and I am resourced. I have fluidity in my body. I have fluidity in my adaptability in my emotions. I, ideally, I'm surrounded by a container that helps me feel safe, a scaffolding of community and providers that help bring me to a stand for myself, right? It's
Yeah.
it's it's building that capacity, a greater capacity to feel the inevitable falling apart that's going to happen, because that's how transformation happens. And in the West, we have a hard time with like destruction, transformation, death. I really love the approach in India where they talk about like Shiva, the destroyer, and even in indigenous American spirit practices, they talk about like the seasonal change and how fall and death is part of the life cycle to clear out and make way for the new. And
Yeah.
so, we go through these cycles, and you're gonna have times in your life where things fall apart, and you can choose to stay in the bracing that happens, which of course initially we're going to split, normal. But you can choose to stay in that, or you can choose to soften again and again. And that is the way forward. And that is the way to have a more full expression of your unique magic of who you are in the world to become who you were meant to be.
That's so beautiful. I love it. How can our listeners connect more with your work? If there's more you'd like to share, I think that's wonderful as well, but there's absolutely nothing I could say that is more than what you've just stated. This is just so beautifully said.
Thank you. Well, the best place to start is I'm on both Instagram and TikTok. It's at Dr. Satya Wellness, DrSatya Wellness. I share a lot of free tips there, and there's also more resources linked in my bio. My website is also drsatyawellness.com. Um, and for providers listening, I also do teach a certification in the NeuroFascial Flow Method, especially for those who work with kids or complex cases and want to bring this framework into their care. So if that resonates, just reach out, send me a message. I love helping individuals more powerfully express who you are in the world, and clinicians expand their impact in ways that also nourish your own energy and help you feel most fully expressed in your purpose as a healer.
That's beautiful. I love it so much. Thank you so much for coming on. I really appreciate having you here, Satya. Take care.
Thank you for having me.